and welcome to Dr. Laura's Lair. Power on. Uh-oh. I'll get the broom.
Hi, everyone. This is Laura from Dr. Laura's Lair. I wanted to provide a little bit of an update. The world is kind of taking off with a new virus, and it's called the novel coronavirus. So the situation is really changing day by day. I was trying to wait to collect some good information once we knew a little bit more to share with you from the podcast. But it's such a moving target. So I'm going to give you a little rundown, a little update. I've taken all this information from the World Health Organization. With this, there's so much misinformation. There's so much rumors. There's so much poor reporting. So if you are looking for information yourself, please be sure to look up credible sources or health organizations in your area. So, what are coronaviruses? I think that's one of the big questions that people have. It's actually a large family of viruses, and they affect both humans and animals. Some infect people, and they're known to cause some illnesses ranging from common cold to really more severe diseases, such as MERS, so the Middle East Respiratory Syndrome. So that was a few years ago that came out. And of course, SARS, which is the severe acute respiratory syndrome. These can cause pretty profound levels of illness, or it can be something more mundane. So why are they called what they are? So coronaviruses itself, they have a little core of all their genetic information, and there's protein spikes that go all the way around it, like a little envelope, and it resembles a little crown. So in Latin, crown is corona, and that's how it was named. So they're really a large group of viruses that cause a real range, like we talked about. Sometimes it's respiratory, sometimes it's gastrointestinal, like stomach bug type of stuff. So a new novel coronavirus is a new strain. It's not been previously identified before in humans. So novel just means new. It's now called the 2019 novel coronavirus, and it was not previously detected before the outbreak, which was reported in Wuhan, China in December 2019. They're currently trying to come up with some sort of name, so it'll have like a short, snappy name like MERS or SARS or something like that. It is not SARS, but it's the same virus family. It's from the same virus family, but it's not SARS or MERS. As with other respiratory illnesses, the infection can cause some mild symptoms, runny nose, sore throat, cough, fever, but it can be quite severe for some people and lead to pneumonia or breathing difficulties. More rarely, the disease can be fatal. Older people and people with pre-existing medical conditions, diabetes, heart disease, that sort of thing, they appear to be more vulnerable, and they're becoming severely ill with the virus. When this was first reported, there was reports through some of the health notifications that I get about this unknown, unidentified pneumonia that was affecting people in the region. So that's the type of things that the notification change gets started when we start seeing these unusual infections. It causes the respiratory diseases. It can be transmitted from person to person, and it's normally after close contact with an infected patient. For example, in a household or workplace or in a healthcare center, right? So it's really important to get the most up-to-date information about the outbreak. You can get it on the World Health Organization website. The Public Health Agency of Canada has some great information. The Centers for Disease Control in the States, they have the information. If you're looking at random websites, just be aware that not the most up-to-date information is there, nor the most credible. I've seen some very weird and wacky people claiming for different cures like sesame oil and unusual stuff. Be critical of what you're reading. It's so important to be a mindful consumer of anything that you're reading online. So what are we going to be able to do to protect ourselves? Well, first of all, wash your hands. Do that for everything, not just this. Wash your hands frequently with an alcohol-based rub or soap and water. It kills viruses. It's flu season as well, in addition to all of this. People are dirty, hands are dirty, wash your hands. End of story. It's also important to maintain a social distance. So it's recommended 1 meter or 3 feet between yourself and other people. Those that are coughing, we don't want to get too close to people. If people are sneezing, coughing, or have a fever, that goes for anything, not just coronavirus. It's for everything. We don't want to get too close and share those germs. When someone who is infected with any respiratory disease coughs and sneezes, they project small little droplets and they contain the virus. So if you're too close, you can actually breathe that in. So we don't want to be doing that. Also, don't be touching your eyes, your nose, and your mouth. When you touch surfaces that could potentially be contaminated by the virus, when you touch those spots, your eyes, nose, and mouth, it can actually transfer the virus to those surfaces. If you have a fever, cough, difficulty breathing, seek medical care early. Tell your healthcare provider if you have traveled to one of those areas, like in China, in the Wuhan area, and in the greater province around that area, or if you are in close contact with someone who has traveled to that area and has respiratory syndromes. So right now, it's pretty, fortunately, it's that larger area in China, so just be mindful. Whenever you have a fever, cough, difficulty breathing, make sure you get any medical attention anytime, whether it's for the novel coronavirus or something else. Respiratory symptoms with a fever can have a range of causes, so depending on your travel history and circumstances, your physician and medical personnel will need to deal with that and rule that out. Remember, I'm not a physician, I'm not an expert. Always be sure to check with your personal care physicians. If you have mild symptoms and no travel history to or within China, just remember to practice basic respiratory safety, hand hygiene, stay home until you're recovered, that sort of thing. In Newfoundland and Labrador, in our province, there's a health line that's always manned by professionals, so you can always call them if you're concerned. So that's always a great way to do it. People that are actually living or traveling in an area where the novel coronavirus is circulating may be at risk of infection. Right now, we know that it's circulating in China, and that's where the vast majority of people affected have been reported. Those infected from other countries are among people who have recently traveled from China or have been living or working closely with those travelers, such as family members, co-workers, medical professionals caring for a patient before they knew the patient was infected, those type of things. Of course, healthcare professionals caring for people are high risk and must really protect themselves with appropriate infection prevention control. And right now, the World Health Organization is saying that people living outside of those areas, the areas in China affected, and don't have contact with anyone who's traveled to these areas are at a minor risk of this infection. Of course, this is changing daily. So right now, the World Health Organization is closely monitoring the epidemiology of this outbreak to really understanding where it's circulating, how people can protect themselves, and how it's spreading and changing over time. There's these things on the World Health Organization website called situation reports. They're available to anyone, not just healthcare professionals. You can log on and it gives you the stats. It shows you the epi curves, so it tells you the number of cases, and so you can see those visualizations of how it's changing over time. From a public health nerd point, it's fascinating. And just from an organizational standpoint, the work that's being done is immense. And it's truly, really important and critical work that's being done. We still need to know a lot more about the 2019 novel coronavirus and how it affects people. Thus far, older people and people with compromised immune systems, pre-existing medical conditions, they seem to be at the higher risk of developing the severe disease. So that's the groups that are being really, really closely followed, although everyone's being followed at this particular point. So the new coronavirus ultimately is a respiratory virus. It spreads primarily through contact with an infected person through respiratory droplets generated when a person coughs, sneezes, that sort of thing, through droplets of saliva or discharge through the nose. It is really important that everyone practice good respiratory hygiene. For example, if you sneeze or you cough, do it into your elbow or to a hanky or a napkin, that sort of thing. Throw it away right away and a closed bin. Also, hand washing. We can't stress this enough. Wash your hands with either alcohol-based hand rub or soap and water. Get your little Purell things. Go mad with them. So just to give you an idea about the situation at this particular point, at this point, it's 24,554 confirmed cases in the last 24 hours. This is the update. Almost 4,000 in the last 24 hours. In China itself, this makes up the majority of them, so it's 24,363. At this particular point in China, there's been 491 deaths. Outside of China, within the last 24 hours, is 191 confirmed cases, and there's been 1 confirmed death. This is over 24 countries at this particular point. So it's really important to keep in mind that I'm recording this on February 5th at approximately 6 p.m. And that's what the situation report is at this particular time. So this is going to be changing day to day. The epidemiologist with the World Health Organization is tracking this with the utmost care. So right now, World Health Organization provide a risk assessment. The risk for this particular pathogen in China is considered very high, and then the regional level is considered high, and the global level is high. So this is something that's taking up a lot of attention, and rightfully so. This is a moving situation, and it's changing every hour, basically. There's a lot of misinformation, so I certainly encourage you to check out reputable sources. And then, of course, wash your hands. It's really, really important. It's flu season. Even if this fizzles out and we don't see anything in your particular area, hand hygiene is never going to go astray. So thank you for your time, and take care and be safe. Thanks.
Attention all Podbean, iTunes, Stitcher, and TuneIn radio listeners. The Odd to Newfoundland Paranormal Podcast brings you the best in East Coast esoterica on the first of every month. Together, we can keep it growing by sharing the show on social media, subscribing to the show wherever you may be listening to it from, and by leaving feedback about your favorite episodes. John certainly needs a friend like you to help make his dreams come true, minus the alien abduction dreams. That is not cool at all. The Odd to Newfoundland Paranormal Podcast. Always available, always free, always odd.